the experience that I have talking with the patients, because I saw all the patients after they have the treatment the next day. I asked them if they tolerate pretty well without any discomfort. They say that was very quickly. They were spending more time in the treatment room. All of them that they have a decrease in the symptoms, although we are doing the follow-up for the month. We will collecting the data for those patients. And a very important question that I bring from my experience in refractive surgery is if they will repeat the treatment, and all of them say yes. They say that they feel comfortable enough to, if we need it, they can do it again. Next. What is the opinion of the technicians? Here, I have in my team, there are several nurses that help us in the treatment. That really liberate my time to see the patient, talk with the patient, and not doing the procedure. But as the same as the patient, they say does not require much. They say does not require more preparation time. It's very easy to perform, not time consuming, according to the same way that the patient said, and very convenient that they don't have consumables that have to change or interchange. That's just clean the different instrument that we use, and that's it. It's ready for the next patient, and that creates we have a very busy clinic on cornea, in particular in dry disease. Around 40, probably 50% of patients are dry patients in our cornea service. Next. And this is my own perspective. This, as I mentioned, this is a report of serious cases that is being followed. We need to complete the 1 month follow-up really to do, again, the mammography, the OSD, and all that. But I can see in our experiences, this type of therapy gives really good results in mild or moderate degrees of MGD. And I will show you a study on that. It's well tolerated by the patients. In the other one, the with the humid heat, it's not that well tolerated. It's very easy to apply in the office by the technician staff. That really makes our times more efficient, and it's very accessible. And both the cost of the system and the price, because that we can charge to the patient, because we don't have this disposable that creates an extra charge on the patient, and the number of patients that we can treat in a morning or an afternoon, or the time that we devote for the treatments. Next. So we, as I mentioned just to show what all the different treatment options that we show to our patient. Well, now we are considering, and we, as long as it's liberated after our clinical research, is part of our therapeutic strategy in what we call incremental complexity. We are seeing this approach very easy for, as I mentioned over there, we plan to use it in mild and moderate MGD in preoperative patients of LASIK, cataract, and glaucoma. Because this is very accessible, it's not time consuming. The patient don't consider that has an invasive treatment before they have the surgery that they are seen to have. And also, I want to bring your attention to geriatric population. It's really well tolerated with this type of patient. And I think this is another population that we are looking into, how to say, to promote more on that type of patient. And we are evaluating, since we have the experience with this young, early teenage or patient, really to see to increase the number of patients in that case. So we have as our first approach for MGD, the MGrx system, and then we can move to the other one, the BFS team, and then has very more severe IPL or other type of approach.